Hi guys, it's Dr. Graham Walker. It's going to be a little different than my normal video content, but I wanted to tell you about colorectal cancer. I don't have colorectal cancer, luckily. I had a colonoscopy that was great on Wednesday, but I wanted to tell you why I'm making this video. I have 5 young men that I know with colorectal cancer. One is dead. 4 others are in their 30s and early 40s with colorectal cancer. So I just think it's really important that millennials, elder millennials such as myself, know what signs and symptoms to look for. And I want to encourage people to also get screened as well. So we're going to talk about it. I won't get into too gory details, but I think it is important to just like talk about stuff to know what symptoms to look for. So I'm going to just tell you. For about 4 months now, I've had some kind of change to my bowels, my bowel movements, kind of different consistency and sizes and shape, no pain, no bleeding, a tiny bit of weight loss, but I'd also been sick for the past month and a half with various ailments back to back to back. And so, I messaged my doctor, Dr. Michelle Allen, who's wonderful, my primary care physician. We kind of talked about it. We ran some stool tests and we tried some other things, increasing fiber, decreasing fiber, and tried getting rid of dairy. Oh, maybe you're a little lactose intolerant, which happens in your 40s as well. And nothing really changed. And my symptoms were a little bit worse in the past couple of weeks. So I just reached out to her. I emailed her and said, hey, things haven't really improved at all. It's been 4 months. What do you think about a colonoscopy? I said, I'll be 45 in a few months. I'd be kind of due for a screening colonoscopy anyway. So maybe I should just get a colonoscopy. What do you think? And she said, yeah, I think that's totally reasonable. If you want to talk to a GI doctor, you could as well, or I can just put in the referral. We've tried all the normal stuff. So I said, I think I'd love to just kind of get the colonoscopy done. Certainly as a physician, I was in my head was like, God, could I have colon cancer? My symptoms are still there and they're not going away. I've never had anything like this before. So she said, yeah, I'll put in the referral. So I'll just tell you a little bit about a colonoscopy and getting screened for colon cancer. We are seeing an increase in younger people, especially younger men, getting diagnosed with colon cancer. Now, we normally think of colon cancer as like an older middle-aged disease in people like 50 plus. But we're seeing a segment of the population, and I don't think anybody really knows why, that are much younger than that, in their 30s and early 40s. So a couple of years ago, the Medical Screening Society said, hey, yeah, I think we should bump down the age of screening to 45. There are lots of ways to get screened for colon cancer. One of the most common one is a colonoscopy. Colonoscopy is nice because you can, if you see polyps, you can go in and remove them. We know that some polyps will turn into cancer in many years, 5 or 10 years. They're very slow growing. But if we remove the polyp, we kind of can prevent cancer. That's pretty cool. But a colonoscopy is invasive and it's uncomfortable and you have to do a bowel prep, and we'll talk about that. So there are other ways to do it. And I'll link to this UCLA handout. I think it's really good. You can do something called a FIT test. You do that every year. And that's looking for chemicals that could be a sign of colon cancer. You can also do the Cologuard test. There was a bunch of advertising for Cologuard a couple of years ago, that poop in a box thing. And the Cologuard is actually looking for DNA that we see frequently in colon cancers that we wouldn't normally see in normal, healthy stool. And there's some other types of invasive tests called a flex sig and a virtual colonoscopy. Some people can't get a colonoscopy, or they'd be higher risk for getting a colonoscopy due to various other medical conditions. So that's why we have lots of different tests for different needs. There are 2 different versions of a colonoscopy. This mostly matters for billing reasons. I'm sorry, Americans, this is how it works, but there's a screening colonoscopy. Screening, if you hear the word screening in medicine, it means asymptomatic. It means we don't think you have any symptoms of colon cancer at all. And then there's a diagnostic colonoscopy. Diagnostic means, hey, you're having some symptoms. We should test this person because we think their risk of this being cancer is higher. It's not just totally asymptomatic. So I had a diagnostic colonoscopy, but the procedure is the same. We probably try to get people in with symptoms faster than we do asymptomatic screening individuals. But besides that, and insurance issues about who's going to pay for it, because screening colonoscopies are preventative care and they're supposed to be covered by your insurance company. Besides that, it's the same procedure, essentially. Um, and so I would just encourage you, if you're overdue for your colon cancer screening, talk with your doctor about it. Again, you don't have to get a colonoscopy. You can get one of these other methods, but it's just a good thing to keep yourself healthy. The last thing I'll just say is I always like to pull in data. This is a study from the National Cancer Institute looking at the time to diagnosis for younger patients with colorectal cancer. And I think because we don't typically think in our heads, oh, young people can get colon cancer now because they didn't used to, it can take longer. It can take like 6 to 8 months. Here's another study in JAMA that it takes, like 5 to 12 months to get diagnosed with colon cancer. The symptoms to look out for, you should talk with your doctor about. That's going to be like bleeding, and bleed. A lot of people say, "Oh, it's bleeding. You're young. It's a hemorrhoid." It certainly can be a hemorrhoid. Often it is a hemorrhoid, but not necessarily. Can be change in your stool habits, bloating, abdominal pain, change in stool caliber. So if you're like pooping like a pencil, you're not having like a big old turd come out. Change in your bowel movements and habits. Those can all be symptoms of colorectal cancer. So you should talk with your doctor about it and come up with a plan to address it. Okay, so I just wanted to go into my actual experience because I just wanted to give some props to KP San Francisco. It was really so smooth and like absolutely the way I think healthcare should be. Like I thought, I was like, it's A plus material. I have like nothing to complain about. So getting a colonoscopy is kind of a pain in the butt, pun intended, because you have to have a bowel prep. You have to be washed out. You cannot have any food or poop in your colon if you want the doctor to be able to look at the walls of your colon on the inside and figure out if there's a mass there, or if there's a cancer, or if there's a polyp that needs to be removed. This is kind of what a simple overview. You take a bunch of medicines. They often will give you some sedation. I had sedation as well to make it more comfortable because it is a bit of an uncomfortable procedure, especially the deeper in you go. They put in a small camera and they will snake around from your anus into your rectum, to your sigmoid colon, up to your descending colon, across your transverse colon, down to your ascending colon, and they stop at the cecum, and that's the connection between the small intestine and the large intestine, or the colon. So that's the test. That's the colonoscopy. And honestly, it requires a lot of coordination to have the patient take the right medicines at the right time on the right day, because you have to like stop eating food on a certain day and only do liquids the following day, and drink the medicine at the certain time of day, so that you can time things to be kind of cleaned out by the time you go. So I want to just say, like, I was over communicated to, and that's actually how I think this should be. You really want to hammer home to the patient, like, do this, don't do this. Today's the day. Tomorrow's the whatever the day for colonoscopy. So I got text messages. I got this secure message from the GI department, which was outstanding. Like, it goes through everything. Hey, you're going to get sedation. You have to have a driver, or we will not do the procedure on you. Here's what to do for the procedure. You're going to get these medicines. 3 days before you get the procedure, you need to do this. 1 day before, you need to do this. I think, on Monday night, I got like a text that was like, this is your last solid food until your colonoscopy, like as just an extra reminder. So this was really great. Like, they even wrote down the day, the date for me to do certain things, a list of FAQs, what medicines should you take or not take, what I should bring to the hospital, where should I go to check in, if I had diabetes, should I take my full dose of medicine, stop the medicine, hold it, all this other stuff that's kind of confusing. And you can see this is a lot of information to tell somebody. So I thought that was really outstanding. I kind of lucked out. There was a cancellation, and so I was supposed to get my colonoscopy in July, and they called me and said, "Hey, do you want to get it on Wednesday?" I was like, yeah, let's get this done. So I picked up the medicines, and honestly, the bowel prep, the medicines, is certainly the worst part. It's not enjoyable. There's like I've done one in the past where I drank Gatorade, and that was much better. This one was just literally a gallon of water that you fill up from the tap, mix it with some medicine that makes you poop everything out of your bowels. You spend most of the evening and the next morning on the toilet. It's not painful. There's like bloating and cramping, not cramping. There's bloating and like a lot of gurgling in your stomach, and you're like, oh God, but it's fine. It's not painful. Like it's not like you're kind of pooping out liquid rapidly, frequently. But that, yeah, honestly, that is the worst part of this entire process. But it's manageable to see that I don't have colon cancer. Um, the colonoscopy visit was fantastic. Everyone was very friendly. I think Alice was my pre-procedure nurse. I got some sedations. I don't exactly remember her name, but Alice was wonderful. Put in my IV. And then I got two medicines, fentanyl and Versed. Those are medicines we commonly will use for sedation to make it so that I'm still breathing and I'm monitored by someone, but that I'm more comfortable and not really conscious. And then the Versed medicine, midazolam, makes you not remember the procedure as well. So that whole most of that or much of that day is foggy to me. It's just kind of a side effect of that medicine. And then I just want to give a shout out to my endoscopist, Dr. Jeff Lee. Jeff made me feel like super safe and just like acknowledged my symptoms. He, said like, hey, I saw your chart. I saw your symptoms. I'm glad you're here. We're going to take really good care of you. I'm generally an anxious person because we as doctors like to be in control, and I'm in the patient role and I'm not in control. So certainly a good reminder for me about that. And so just Jeff was so wonderful and so warm and made me feel like honestly really safe and something that was really kind of freaking me out. And luckily, woke up, I think like, I don't know, 30 minutes later or something with another nurse, Tracy, who I know from the ER. And she said, yeah, everything was fine. You had a small little polyp, no cancer, no mass. And so obviously a huge sigh of relief for myself. I know there was probably somebody that exact same day that my exact same age that probably had a colonoscopy and didn't get the same news. They got the news that they have colorectal cancer. So I am so thankful for my health as well. And then, the last thing I'll just say is like my little polyp that they removed, I had the pathology results back a day later. Like it was so fast. I thought there's no way this is my result, but it was incredible. And then the last thing I have to just talk about, of course, is how could AI have made this better? Because I love to just talk about how the experience could be even better. So one idea here is like, here's my pathology result. Me as an ER doctor, an experienced physician, I don't really know what this means. I don't know what this with lymphoid aggregates. Is that normal or is that bad? I know what the word lymphoid means. I don't know if it's normal. So I just popped it into ChatGPT and it says, hey, it's normal. This is benign. Good news. So this was super helpful. Obviously, ChatGPT knows that I'm an emergency physician, so that's probably why it's saying what it's saying in its own language. It even has here a thing if I'm explaining it to a colleague. So wouldn't that be cool if like that pathology result was just automatically popped into ChatGPT and put into English as well? Very cool. And then the last thing I will say is, pretty interesting idea here. Like, could you take this long, drawn out colonoscopy visit information and like summarize it or simplify it for the patient? So imagine if there was a proactive patient module that let me say, hey, I want to give Kaiser some additional information up front, and in exchange, you're going to like personalize the information you give me to make it really feel like it's just for me. So I don't have diabetes, so don't tell me about the diabetes stuff. Wouldn't that be cool? And you can always like still get back to this longer form content. But so I took this information and popped it into ChatGPT and talked about, gave it a patient with. I tried to trick it, make it difficult. Gave it a complex patient here, and they'll have their spouse pick them up, and it like customized the information honestly really well. You'll notice it actually removed this information about how to get a safe ride home, because I had told it about there's a spouse picking them up, I thought it screwed that up and it omitted those instructions, and it corrected me and said, "Oh no, I removed them because you told me their spouse was picking them up." I mean, it was brilliant. Again, this goes through the same information, but just in a simpler way. And now, because the patient's on diabetes medicines, it's giving the customized information for the patient's medicines and dosages of what to take, what not to take. Here's the day of the procedure. What medicines should I stop, et cetera, et cetera. So just a quick, again, thank you to my medical center. I really don't think anybody actually knew that I was an emergency physician that works with them, because I don't really interact with those departments very often. I think I just got really good care from a great medical center. Thank you to my primary care doctor, Dr. Lee from GI, the entire GI department, Alice and Tracy, my nurses. I don't remember everybody because I got Versed. I'm really sorry. But just thanks for taking care of another human being who was really anxious and scared one day.